When people get insurance, they think they can access their prescription drugs and other health services, but really, that's just part of the story. And they think they paid their premiums and they can access their drugs. But unfortunately, it doesn't work that way. And a lot of it has to do, yes, with the insurers, but PBMs, the pharmacy benefit managers, also have a major role. They're the ones that really make a lot of the decisions on, one, is the drug covered or not? And then secondly, that's a big barrier too. The doctor prescribes the drug and you want to get it filled and pick it up, but your plan doesn't cover it. So that's a decision made by the PBM. But then there's so many other barriers after that to access the drug that your prescriber prescribes. You may have to jump through some prior authorization or step therapy hurdles, and that means you can't qualify to take a drug until you do certain things, and some of those things are really ridiculous and really hard to do, and it's really just a block to accessing the drug that you need.
And a lot of times that can really lead to worsening health outcomes for people. It can make a drug less effective for them. If they make it back, it doesn't mean that the drug will be as effective for them anymore. And so, that's lower quality of life. It can also add increased out-of-pocket burdens to patients. It could require them to check in more frequently with their provider as they're moving through a step therapy process. And so it's additional time and effort on the patient, really for no medical reason. It's a practice that is put in place by the plan and is not always at the best interest of the patient. And so I think that's why it's really important for us as UCB to work with patient groups to remove barriers such as prior authorization and step therapy, or to just create an exceptions process.